When you need treatment for an injury or condition, it is essential that you choose the right practitioner for you. There's a lot of information out there in terms of what different practitioners can and can't do, and it can get really confusing. Today, I want to shed a little light on the similarities and differences between what a physical therapist can do and what a chiropractor can do. And by the end of this video, you'll have a little more education in terms of which practitioner is right for you. Hi, my name is James Ingram. I'm a physical therapist at EW Motion Therapy, and today we're going to talk about some of the similarities and differences between physical therapists and chiropractor, what they can and can't do. So when it comes to similarities between a physical therapist and a chiropractor, there really is a lot of overlap between the two disciplines. So one of the most notable similarities is in the education process. Both disciplines require a 4-year bachelor's degree before you can enter the program. Once you've entered the program, most of them are 3-year doctorate degrees. Chiropractors will graduate with a chiropractic doctorate, whereas a physical therapist will graduate with a doctorate of physical therapy. So both disciplines also require a national licensure exam before you can start to practice. And then there are other requirements that kind of vary from state to state. So in terms of similarities of treatments between a physical therapist and a chiropractor, both disciplines are going to use various techniques and interventions to address the same issues. So one of the things that we see in the clinic all the time is kind of tension headaches. Someone may be sitting at a desk for a long period of time and stress just kind of builds up. Both physical therapists and chiropractors can address the same issue. We might do it in slightly different ways, but we're still addressing the same issue. Both disciplines are going to use various mobilization and manipulation techniques to try to just calm the area down and ease tension to get you a little bit more relief so you can go about your day. So another similarity between the two is it is within the scope of both disciplines to prescribe corrective exercise, although what corrective exercise looks like can kind of vary from discipline to discipline. So when it comes to differences between a physical therapist and a chiropractor in terms of treatment interventions, the biggest difference is really in treatment philosophy. A chiropractor will typically address spinal alignment versus malalignment as the root cause of pain, where a physical therapist is going to try to increase functional movement patterns in order to decrease pain. Another large difference between the two disciplines is chiropractors can order x-rays. Many chiropractor clinics will have these, x-ray machines on site. They'll do the image and then they can kind of talk through the image with you and what they see, and they'll design a plan to try to help realign everything that they see. Whereas certain states are slowly starting to allow physical therapists to order imaging, but it is not across the board case. Physical therapists in the military can order x-rays. So when it comes to differences in treatment between what a physical therapist will do and what a chiropractor will do, it's easiest to kind of demonstrate this by just talking through an example. So the example we used earlier was a tension headache. With this forward stoop posture, if you've been sitting at a desk all week, pressure starts to build up through your neck and all this musculature. What a physical therapist will most likely do will start with soft tissue mobilizations, try to decrease muscular tension in the area, and then perform corrective exercises after that to try to maintain a more upright and normal posture and try to keep those muscles up here from flaring up again and causing a tension headache. Whereas what a chiropractor might do, instead of soft tissue mobilization, they will do spinal manipulations or adjustments. Then that can potentially follow with corrective exercise after the fact. So treatment frequencies will also vary between the two disciplines. If you have a flare up, your neck, your back, whatever it may be, you can typically get into your chiropractor pretty quickly, and they'll have you adjusted 1 or 2 sessions and have you back out doing the things that you want to do. whereas a physical therapist may structure things a little differently. The length of treatment may be a little bit longer, but there's a little more emphasis on injury prevention with the corrective exercises that a physical therapist will prescribe. Whether you choose to go to a physical therapist or a chiropractor is ultimately up to you. It is your decision. The most important thing though is to find a practitioner that really cares about getting you back to living your life the way that you want to live your life and doing the things that you want to do. If you're interested in learning more about physical therapy, click the link in our description below to watch our video on how to choose the right physical therapist. This video details the top qualities to look for when choosing the right physical therapist for you.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.